Hi, good evening. This is Dr. Chetna Jain, Director at the Cloud9 Hospital Sector 14 and Director Owner at Dr. Chetna's Clinic in Palam Bihar, Gurgaon. So today we are going to talk about a serious topic which is known as postmenopausal bleeding. Now, there's a lot of ignorance about it and a lot of shame around these women who are already in their sixth decade. They do not wish to talk about their periods. They keep on holding such symptoms till they become really, frankly, cancerous, and then probably they need to suffer a lot. So, what is menopause and what is postmenopausal bleeding? So, menopause is absence of periods for absolutely 1 year. In this we have to be sure that the woman is not pregnant. So all those women who are pregnant do not qualify menopause. So any woman who is not pregnant and not has not had her periods for 1 year is likely to be menopausal, more so if she is 40 plus years of age. Now, once you achieve menopause, which is normal age is between 40 to 54, but commonly 90% of the women will achieve their menopause by the age of 51. Some might continue to bleed till the age of 54. The rest will finish by sometimes as early as 40. So once a woman has achieved menopause, there's no reason for her to bleed. So any bleeding beyond menopause, beyond 1 year of no absence, complete absence of periods, is known as postmenopausal bleeding. Typically, the first episode of bleeding is very mild. It's seen in the form of few drops. Now, what are the causes of bleeding after menopause? So 11% of the cases for those who bleed after menopause are likely to have some kind of genital cancer. It could be vagina, vulva, cervix, uterus, fallopian tubes, or ovaries. So these are the genital organs which are responsible. Majorly, women in the sixth decade postmenopausal bleeding occurs essentially because of uterine cancer and less commonly because of ovarian cancers or other cancers. Now, the bleeding could be very minimal, and women tend to ignore it. They do not want to see the doctor. They do not tell any family member, and the episode is completely forgotten. Then, after a couple of weeks or months, or rather years, the bleeding comes back again, and this time it's a little more. She gets a little worried. She comes to a gynecologist where an examination can be done, which doesn't reveal anything except some bleeding coming from the uterus. On ultrasound, you realize that the lining of the uterus, which at after menopause is typically either indistinct or below 4 millimeter, is measuring like 6, 7, 10, 12, 14, 20, whatever, depending on how bad is the condition. Now, there is a challenge. Most of these women are still probably having a precancerous disease, but there are a couple of women who have already progressed to the cancer. And these are the women, if they would have reported early in time, they would have survived and saved the trouble of taking treatment of uterine cancer. However, once it is diagnosed, we need to take it up further and see what next. So anytime any woman has any bleeding beyond menopause, that is 1 year of complete absence of periods, she needs to see the gynecologist immediately at the next best opportunity. That would be the same day or the next day. So what will happen? A full history is taken, your obstetric history is taken into account, a personal history of all kinds of diseases like medical history, a surgical history, or any other personal history is taken into account. Thereafter, a local examination is done to look for the lesions, what are the causes of the bleeding. So, a careful inspection of the vulva, vagina, cervix. This can be seen from below. Now, if a cause is identified, then the woman is informed. In majority of these women, there are no local findings, and the blood is seen coming from the mouth of the uterus, that is the cervix. And in this scenario, the simple investigation requested is an ultrasound. This ultrasound is typically done through the front passage, that is the vagina, and it is done through an internal TV probe and known as TVS or transvaginal sonography, in which what we see is what is the size of the uterus, what is the condition of the endometrium, is the lining distinct or hazy, how is the endometrial myometrial junction, how are the fallopian tubes and the ovaries, are there any associated distension or cancerous lesions in fallopian tubes or ovaries. in most of these women, the lining of the uterus or the endometrial thickness is identified to be more than 4 millimeter, and this is known as a thickened endometrium. This would need a further investigation. However, if on ultrasound the endometrium is normal and if there is an ovarian cyst, then this could be a case of ovarian cyst or a ovarian tumor or a ovarian cancer, which needs to be verified and diagnosed. So what next? So the first thing would be, if it is the thickened endometrium, then we need to insert a camera into the uterus. This is known as hysteroscopy. Have a look on the inner wall of the uterus and see what are the difficult patches. Are there any patches of cancer, suggestive of cancer, or there are any other patches which is suggestive of a thickened lining? Sometimes a grape-like tissue is hanging if within the uterine cavity, and that is making the uterus very thick, and these are endometrial polyps. About 10% of all endometrial polyps in these women could be cancerous. Now, so on hysteroscopy, from the best of the places wherein the tissue is thicker and denser, the biopsy is taken. And after that, a general curettage of the uterine cavity is done, which is popularly known as DNC, and all tissue is sent for histopathological examination, which you commonly call as biopsy. Now, what happens if the uterine lining is completely normal and the disease appears to be in the ovaries? If the disease appears to be in the ovaries, there are certain blood tests which are known as tumor markers. They are sent into the laboratory and the lab results are awaited. If these tests are absolutely normal, then the chances of malignancy is less but not zero. Meanwhile, a more detailed investigation is ordered, which is typically an MRI pelvis with contrast or a PET-CT scan. Now, what is an MRI pelvis? This is magnetic resonance imaging of the pelvis. By giving some contrast, we can see situation better. But if the woman is not fit to take contrast, like in renal disease, we can do a plain MRI. The idea of doing MRI pelvis and lower abdomen is to look for any indistinct junction between the endometrium and the myometrium to identify invasive cancer, and also to look if it is an ovarian disease, to look at how far the disease has progressed, what is the situation, are there any septum inside the cyst, are there any nodules, any other solid components, and most importantly, whether they are associated enlarged pelvic lymph nodes. If they are associated multiple enlarged pelvic lymph nodes, the suspicion of cancer within the ovarian tumor or the uterine cancer is high. Then once this report is done, the other test which can be done is a PET scan, a PET-CT scan, in which the whole body is screened after giving a drug, and any portion of the body which would be having a metabolically active lesion that is likely to be cancerous, and they are picked on the reports, and then we focused on that to identify if there is any suspicious cancer. Once the disease is diagnosed, and so what could be the various causes of postmenopausal bleeding? So there could be a simple hyperplasia of the lining of the uterus. That means the uterine lining has become active after the menopause, which is not a good thing, and when left untreated, it can become cancerous over next 10 to 15 years, or sometimes 20 years, depending on the type. So it could be a simple hyperplasia, or there could be hyperplasia with early malignant changes. It could be an early invasive cancer or an advanced invasive cancer of the uterus. Or in cases of ovarian tumor, typically the disease is more advanced, which could be a stage 2, 3, or 4, depending on the situation, whether the disease is contained within the ovaries or it is spread beyond into the pelvis or other distant organs. So it is important to do some kind of staging or some kind of diagnosis before a final treatment is taken. Now, in majority of the cases, the biopsy report after the hysteroscopy and DNC comes as simple hyperplasia. Now, simple hyperplasia means there is an excess of estrogenic activity within the uterine cavity, and if left untreated, it can lead to malignancy. So what can be treated? What can be done? So either we can put the patient on prolonged progesterone treatment, so she needs to take progesterone tablets orally every day, and we do a repeat biopsy after 6 months and see that the disease is reversed. If so, then the patient is called every 6 months for a couple of times till we are sure that the disease has regressed, and that then she is seen every year. Now, in case the next biopsy also shows the hyperplasia, then other modes of treatment can be tried, which can also be tried as first line, which is the local placement of the progesterone in the uterine cavity, or the levonorgestrel IUD, intrauterine device, is placed, popularly known as Mirena, into the uterine cavity. And this will reduce the effect of estrogen on the endometrial lining and reduce the growth of this lining, and thereby probably reverse the simple hyperplasia to a normal atrophic endometrium, which is the typical postmenopausal lining, or else it will not cause any major change and the bleeding still continues. If any woman, in spite of taking progesterone, will continue to bleed, she's more likely to have further cancer compared to those who do not. Similarly, after stopping the treatment, if the bleeding still comes back, then these women are more likely to develop cancer. So all those women who are more likely to develop cancer, who are actually not cancerous, or it is a precancerous disease, or an early invasive disease without the lymph nodes, a laparoscopic removal of the uterus, cervix, both fallopian tubes and ovaries is the final answer. It works beautifully and the results are amazing. There is no return of cancer anytime in the body, and the woman is almost cured. However, if any pelvic nodes are enlarged or the disease is spread to a certain level that it becomes stage 2, in this scenario, they would need some kind of local radiotherapy, which could be very taxing and tiring and can lead to serious side effects. So, dear, to prevent any progress of disease, as if anyone is having a postmenopausal bleeding, they should immediately report to the doctor and should be seen at the first opportunity. All investigations should be performed. And in case it is an early cancer or pre-cancer or a simple hyperplasia, wherein the woman is unwilling to have regular repeated DNCs every 6 months till proven to be completely cured, the best answer is a total laparoscopic removal of the uterus along with both adnexa, and you can be free for life. There would not be any danger. The operations has become so simple. The hospital stays minimal, the recovery rate is faster, the pain is minimal, and you return to daily life activity is within 5 to 7 days. There is no blood loss and no need of blood transfusion. So it's a beautiful surgery with the current equipments. It is very simple and very easy. So please do not ignore your symptoms. And in case you have any issues, please bring them up quickly with your family, see your doctor as soon as possible, and get rid of the disease. But if the disease is elsewhere, like in the ovaries or other organs, the situation is not that simple. Then you're more likely to have an advanced disease, more likely to be needing more treatment. Now, let us discuss if the disease, suppose the disease is in the ovaries. So, this is known as ovarian cancer. The cervical cancer is very unusual in such a group. Cervical cancer is essentially a disease of younger women. In the 60s decade, in the postmenopausal women, the disease is either the uterine cancer or the ovarian cancer. So ovarian cancer is seen well on ultrasound and MRI, and the pelvic nodes are seen on MRI. So depending on the stage of the cancer, a treatment can be taken. If the disease is contained within the ovaries, a simple removal of the ovaries intact without opening them into the abdominal wall, along with some peritoneal wash, that is, take out some cells from around surrounding tissue and a small piece from the omentum, which is a fat curtain of the abdomen. And if all this is clear, then probably you are done with the problem. But if the disease is more spread and it is outside, then a lot of chemotherapy is required. But sometimes what happens is the disease is so much advanced that it is inoperable. In such a situation, first 3 months of chemotherapy is given, thereafter the disease is operated, and then the post-operative treatment again is done by chemotherapy. That becomes very cumbersome, and the 5-year survival rate in such a disease is very less compared to the uterine cancer, wherein once the disease is removed completely, and if it is in the early stage, the survival rates are high. A few women will need radiotherapy, the rest will be fine without it. So please, again, my request is anytime if you see that if you yourself or anybody around you has postmenopausal bleeding, has to be brought to the notice of the gynecologist, who can take action at the appropriate time and prevent any invasive disease coming into the body. That means you prevent any advanced stage disease and treat the disease at a very early stage in a very, very simple manner. And there are no long-term consequences, no long-term hospital follow-ups, no radiotherapy, no chemotherapy, and you can just relax and enjoy your life with no impact on long-term survival or any kind of health issues post the surgery. So please, anytime, if anybody is having postmenopausal bleeding, please bring it to our notice so that we can help women live a better quality of life rather than suffering the disease and taking all sorts of surgical treatment and radiotherapy, and in spite of that, not improving after the treatment. Thank you very much for today's webinar. In case you've got any questions, you can put up, and we'll be willing to answer those questions. So there is a question: what is the most common cause of postmenopausal bleeding? So Shilpa, the most common cause of postmenopausal bleeding is the uterine cancer, or the simple endometrial hyperplasia, where there is a thickened lining of the uterus, which is a precancerous state of the uterus. Again, the same question: how common is postmenopausal bleeding? Postmenopausal bleeding is probably seen in about 0.5 to 1% of all women. It's not that common. 1% of all postmenopausal women. So it's a little uncommon condition, but whenever it happens, mostly it is serious. What is the treatment of postmenopausal bleeding? So depending on where is the location of the disease, if the disease is located in the uterine cavity, then the removal is simple treatment by laparoscopic removal of the uterus, cervix, fallopian tubes, and ovaries. If the disease is just simple hyperplasia and the woman doesn't need a proper surgery, and she doesn't want, or she cannot be operated because of a medical condition, then an intrauterine progesterone containing device can be inserted, and she can have a follow-up DNC every 6 months for a couple of years, till the time she is deemed completely negative of the disease. So either a simple removal of the uterus or repeated DNCs to ensure that the disease doesn't progress. So this is when the disease is contained to the uterine cavity. However, when the disease is in the ovary, the best possible action would be to remove the pelvic organs as soon as possible and see what is the stage of the disease, and depending on she would need a further chemotherapy or the radiotherapy. Normally it is the chemotherapy if it is an ovarian cancer. Can stress cause postmenopausal bleeding? Certainly not. Stress can never lead to postmenopausal bleeding. However, a few women can, because of the vaginal dryness or vaginal candida infection, can itch themselves so much so that the itching can cause erosion and there is bleeding from there. That case of postmenopausal bleeding could be stress related, wherein you have itched yourself so badly that you start bleeding. But this we typically don't see, because nobody can scratch themselves so much that they start bleeding. Thank you. We'll be back next Tuesday, 5:30, with some more questions and with some more problems. Till then, bye-bye.